Post-traumatic stress disorder, or PTSD, after a sexual assault. What is sexual assault? Merriam-Webster defines sexual assault as follows: illegal sexual contact that usually involves force upon a person without consent or is inflicted upon a person who is incapable of giving consent, as because of age or physical or mental incapacity, or those who place their assailant, such as a doctor, in a position of trust or authority. The prevalence of sexual assault is 1 in 4 women and 1 in 6 men will experience sexual assault at some point in their lives. 1 in 10 victims know their perpetrators, and 1 in 7 victims are under the age of 6. Of all of the rapes, 29% include the use of a weapon. Of those that are developmentally disabled, 32% of males and 83% of females are sexually assaulted at some point. 81% of elderly sexual abuse is caused by the primary caregiver. So what is post-traumatic stress disorder? It is also known as PTSD, and it is a disorder that happens as a result of some sort of traumatic event in one's life. This can include any type of traumatic event, but we will be specifically focusing on sexual trauma. Traumatic events can and typically do cause the victim to feel helplessness and intense fear. Victims often self-blame. Symptoms of PTSD include re-experiencing trauma through nightmares, obsessive thoughts, and flashbacks that are presenting feelings of going through the situation again. Avoidance of people, situations, songs, movies, places, etc. Increased anxiety and having a heightened startle response. Treatment of PTSD can include psychological treatment, medications to alleviate some symptoms, therapy, and psychotherapy treatment. Prognosis can range from moderate to very good. Sometimes can occur from one incident, sometimes from chronic trauma, and sometimes from ongoing trauma. Who is affected? PTSD is higher among African Americans and rates at 8.7%. Next is whites at 7.4%, then Hispanics at 7%, and Asians at 4%. Different experiences obviously occur depending on what the event is, as well as what the duration is, whether it be a single occurrence, ongoing, etc. Whites are more likely to have sexual trauma or learn about the trauma in someone else's life, such as a child, parent, etc. African Americans, however, have the highest occurrences of PTSD, and Asians have the lowest. Minorities are less likely to receive any sort of treatment for PTSD. Since sexual assault is already so underreported, those that struggle with PTSD have less than a 50% chance of seeking treatment. Trauma in children. Children that are sexually assaulted may have an ongoing issue into adulthood. Early signs are stress and anxiety, difficulty setting limits with people, such as learning when to say no, low self-esteem and body image, depression, erratic sexual behavior, turning to drugs and alcohol, self-harm, and isolation. The child may no longer want to get undressed, including when it is time for bathing and in front of their own parents. The child may repeat behaviors such as bedwetting. In adults, in people aged 21 to 25, it is a 3 woman to 1 man ratio for the prevalence of PTSD. It shows up most in women during their early 50s and in men in their early 40s. Elderly, such as 70 years older or higher, are less likely to struggle with PTSD. Women are twice as likely to struggle with PTSD because of the types of trauma when it comes to sexual assault. Life expectancy plays a role since men are more likely to die earlier, whether it be through accident, natural causes, or through suicide. So, do gender and age matter? Studies show that there are 3 people in different locations in the world that were all the same age that experienced similar traumas, even though they were in different cultural contexts. The effect, however, was different in all of them. This means that there is no consistency when it comes to age that determines how one will react through trauma. The cultural, historical, and economic, and social contexts are more likely to determine variance versus age. As women age, there is less likelihood of PTSD to occur. There are not as many studies done on people that are younger than 6 and people over the age of 54. Sexual orientation. Sexual minorities have a higher prevalence of PTSD because there is more exposure to stress and trauma. There are, however, less studies done on these minority groups. The rates of PTSD are still consistently higher among women. There are not enough studies done with sexual minorities and racial ethnic minorities to compare the two. There is a prediction, however, that African American and Hispanic sexual minorities experience more stress than white sexual minorities. Concerns that occur with PTSD that result from sexual trauma. Roberts states, when PTSD affects U.S. race ethnic minorities, it is usually untreated. Large disparities in treatment indicate a need for investment in accessible and culturally sensitive treatment options. Other concerns include avoidance, it hurting to heal, trauma reminders, seeing sexual assault in different places, such as in music, TV, media, stress reactions after trauma, acute stress disorder, anger issues, sleeping issues such as nightmares and bedwetting, alcohol and substance abuse, depression, suicide, self-harm, traumatic brain injury, chronic pain, and withdrawal from daily activities. Management can come from treatment centers, counseling through cognitive therapy, exposure therapy, and eye movement desensitization and reprocessing, or EMDR, SSRI medicine, or selective serotonin reuptake inhibitors, medications such as antidepressants, MAOIs, mood stabilizers, antipsychotics, etc. Some of the stigmas of reporting and telling about sexual assault include men fearing being emasculated or seen as weak, women fearing being told that they shouldn't have blank, for example, worn certain clothing, been in a certain place, etc., etc. Many don't think people will do anything about it. They're threatened by their perpetrator, scared of the reactions of loved ones, and do not feel that it is important enough to report. So why not seek help? Men are less likely to receive help because of society's view on psychological help. They are more likely to deal with it in other ways. They also do not want to risk having people know that they have been assaulted. Women often just hide their hurt and invest in poor behaviors. Children are often fearful of the reaction they will receive, such as being called gay or other things. Elderly people are often unable to report because they cannot even care for themselves. So there are many different treatments that can happen, but one of them is using prolonged exposure, or PE. Prolonged exposure is a method that teaches individuals to gradually approach their trauma-related memories, feelings, and situations. They presumably learn that trauma-related memories and cues are not dangerous and do not need to be avoided. This comes from the Clinical Practice Guideline. Prolonged exposure helps people to confront their fears and approach their fears that are directly related to trauma and the memories and situations that surround the specific trauma. Fears are reinforced when situations, things, and memories are avoided. PTSD symptoms can be lessened by learning that the surrounding memories and feelings are not dangerous. This is strongly recommended for PTSD victims. Prolonged exposure targets those that are struggling with PTSD so that they can eliminate some of the mental and psychological issues that from their sexual traumas. All of the genders and races and ethnicity groups can benefit from this treatment because it is not biased toward or against anyone. This intervention is further detailed in this following article. So, concluding thoughts. Through prolonged exposure, those struggling with PTSD are able to get back their life by facing the fear of the assault they endured. Men and women can overcome the stigmas that come with getting better after being assaulted. Getting treatment can encourage men and women to talk about the issue through gender and sexuality. This could help eliminate some of the stigmas that also come with sexual and racial minority groups that have been assaulted.